Good afternoon. My name is Chido Chigubu. I work for SolarAid Zambia as a field coordinator. We usually go out into the schools to distribute solar lights to rural communities around Zambia. Right now, that has been put to a stop because of the current coronavirus pandemic and its rising number in infections as well. We have tried the best that we can in terms of trying to communicate with members of the rural communities out there, though we are unable to access some of them because there are places where there is no mobile network or people just can't afford to buy a phone. And right now that is worrying because how do we get the information out there? So what we have been doing is trying to work also with the Ministry of Health. We're trying to work with them to see how best we can help to get the information out there into the rural areas, to get it out there also on time, because right now they are reliant on the health centers, and with villages being spread apart, with maybe the furthest village being 50 kilometers away from a rural center at a time, this proves to be a challenge because they will get the information late, and probably by the time they get the information it may be distorted or it may have changed. So that is a challenge in its own. Where light is concerned, we have health rural centers that are still operating without light, without proper light. We have rural areas that are in the dark right now. We have rural areas that they have to close because at the end of the day they are unable to work at night. But with just one solar light, they will be able to attend to have whoever comes in at any time. They will be able to even go out into the village if there is an emergency and attend to patients should this pandemic hit the rural areas, should the rise of infection also affect the rural areas. So we are currently trying to work as a team to get Zambia, Malawi, London. We are trying to work together to see how we can help our communities, because if we are affected here in the urban area, then definitely people in the communities in the rural area, they have already been affected without light before. Now it is going to be worse because now there is a pandemic on the rise, and it is going to prove to be very difficult for the health professionals, also for people in the rural communities. So we are trying to really get as many lights as we can to at least rural health centers and community members if we can, and also trying to get information through the Ministry of Health. We're trying to get information out there to make sure that everyone is well aware of how to prevent this virus spreading, how to prevent it from being a disaster. If there are any queries, you can visit our website, SolarAid. We are available, and also you can ask any questions that you may have to ask. And we would be pleased to have everyone on board, a global community on board to help people out there that are really going to be in need should this pandemic reach our rural areas. Thank you.